Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're focusing on kidney stones, also known as nephrolithiasis. These are hard crystal-like deposits that form in the kidneys when minerals and salts in urine become too concentrated. So, to help us understand what they are, why they form, and how we treat them, I'm joined by my colleague, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you for having me. My privilege.
Well, let's start. What are kidney stones?
Kidney stones are solid deposits that form when the minerals in the urine, like calcium, oxalate, and uric acid, stick together and crystallize. About 80% are calcium stones, while others may be uric acid, struvite, which is from infections, or rare types like cystine stones. They can stay in the kidney or travel down the urinary tract, sometimes causing severe pain.
All right, let's talk about the different types or stages of kidney stones. And I also want to describe their color, what they look like, because if someone passes one, they'll have this information to say, oh, I was told about this.
Well, we usually describe stones by their composition, and that's what you're addressing, as well as their impact, which is how they hurt. So, calcium stones are the most common, and uric acid stones are linked with gout and acidic urine. Struvite stones, on the other hand, are often found in the urinary tract and are caused by infection. The cystine stones are rare, and they're caused by inherited conditions. Now, when you move into the terms of stages of stones, they're usually small and silent, and they don't cause any symptoms. So you don't even know you have them, but painful on passage because when they move through the ureter, they cut the inside of the tube. So obstructive or complicated, causing blockage, infection, or kidney damage, also caused by kidney stones.
Well, how do we get to a kidney stone in the first place?
A kidney stone is usually dietary in origin. That's why we talked about minerals. And if you eat something too frequent or you don't process it properly, they aggregate and form little clumps. The biggest risk factors are usually dehydration, that's the lack of water, high salt content, or animal protein intake. Obesity, diabetes, and family history all play a role too. Certain medications, diuretics, calcium-based medicines, vitamin C, and urinary tract infections also raise the risk. Stones form when urine becomes too concentrated, making it easier for the crystals to stick together and clump.
Let's talk about family history in kidney stones.
Well, that sure matters. 30 to 60% of the people with kidney stones have a relative with the same problem. Some are born with conditions that make urine more likely to form stones. So the genetics set the stage, but the lifestyle and diet are often pulling the trigger. The actual stone formation can form early in life, and your predisposition you can have at birth.
So, birth factors and development will affect risk later in life.
Absolutely. Babies born prematurely, for example, or those with low birth weight may have kidneys that are more prone to early calcifications. Some congenital kidney conditions, like polycystic kidney disease, also make stones more likely. Even though stones are more common in adults, early life kidney structure and function can influence risk.
Let's talk about traditional Chinese medicine. How do they view kidney stones?
TCM, or traditional Chinese medicine, views stones like most things. It's a balance. So for them, and they are seen as a result of an imbalance between the damp and the heat and stagnation in the circulation in the urinary system. Herbal formulas are traditionally used to promote urination, reduce inflammation, and help the stones pass. Acupuncture may also be used to relieve the pain and relax the entire urinary tract.
How do you diagnose kidney stones in your office?
Diagnosis starts classic symptoms. They come in, they have severe flank pain that radiates to the groin, and we confirm right away. We have them give us a urinalysis, pee in a cup, and we look for the blood or the infection. Imaging is also in our office, so we just march them next door or down the hall, and the ultrasound is first, and we determine right there. The ultrasound is often used because you can look in specific places and have a big heads up on them, and it tells you where they are. The four common sites for stones where they can be formed and lodged in the urinary tract are the kidneys, the ureters, the bladder, and at the end called the urethra. And those stones that are being formed because of the content, the crystals in the urine itself, when they clump together, they develop and get stuck as they go down the tube.
All right, let's talk about standard of care treatments in the United States of America today.
Well, the treatment depends upon the stone size and the symptoms. Smaller stones are the most common, and they pass with fluids, pain medicine, sometimes muscle relaxant, and sometimes medications like alpha blockers or Flomax or something to relax the ureter. Medium stones may require shockwave therapy to break them up. That's sort of fun.
Yeah, well, let's talk about that shock therapy.
Shockwave therapy sends a wave, an ultrasound wave, into the body, and you can target where the stone is. So you're going to have to use something so that you can avoid the surgery. If they do need a surgery, then that's a scope that goes up into the bladder and then into the ureter. And there's another way to do it. You can do it percutaneously. But for either set, you can use a ureteroscopy or percutaneous, which is a cut on the side. You go in the ureter and pull it out. The foundation for all the patients is hydration. Enough water usually eliminates stones before anybody ever needs a procedure. Your urine should always, no matter if you're sick or not, be as clear as water.
Okay, let's talk about regenerative medicine. What are the new therapies?
They have some real good ones, and newer approaches are being studied. L-carnitine protects kidney cells from stone-related injury. Niacin, a B vitamin, B3, I think, is linked to lower stone risk in population. So that's done for prevention. L-arginine, another amino acid, all those are amino acids. So they don't hurt you at all. In fact, all they do is help you. You have them in your body anyway.
And you have these things, IV, in your kidney flush, don't you?
Absolutely.
Ah.
And so L-arginine relaxes the ureter all the way down and allows the stones to pass more easily.
All right. So, what lifestyle strategies can someone who has had a kidney stone and they don't want another one, what should they do?
Well, their lifestyle is key, and not only what they should do, but they should advise their family, because it's all the genetic links here, to drink plenty of fluids first. That's the key. Aim to get your urine looking like water. Then you want to reduce the salt. Animal protein, that's the food that has derived from animals. And you eat more fruits, eat more vegetables, and you get a balanced urine chemistry. That's called the pH. And if you stay active, maintain a healthy weight, and avoid excess supplements. A lot of people are doing overdose on supplements. The high dose vitamin C and calcium are very acidic. Be careful unless they're prescribed.
All right, so let's look at the long-term outlook for someone who has had a kidney stone or recurring kidney stone.
Kidney stones often reoccur, and about half the patients we care for, or maybe a little more, will have another one within 10 years. In fact, they'll sure know it's coming, I'll tell you, because they're so prevalent and they're so painful. So the prevention strategies have to be proactive. You follow up with imaging, so you see, you want to catch them when they're little, when they're tiny. And sometimes medication, so you relax the ureter. And the risk, you want to cut that down significantly. Most patients do very well with proper care because they don't want that pain again.
Let's talk about your mnemonic for kidney stone care. What is it?
It's real easy because this one is stone.
S stands for?
Stay hydrated.
T.
Test the stone if you can get an analysis.
O.
Optimize diet, less salt and more fruits and veggies.
N.
No smoking. Keep weight healthy.
E.
Evaluate regularly with your doctor. Prevent recurrence.
Thank you, Dr. Henderson, for taking us through kidney stones, a painful but preventable condition when patients understand the risks and strategies. If you or someone you know has severe flank pain, nausea, or blood in their urine, do not ignore it. Seek medical help. It could be a kidney stone. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pensanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.